Alright, so this video we're going to be starting chapter 13, part 2. We're going to be looking at objective 6, which is all about the meninges. And the meninges are actually 3 different types of membranes that surround the central nervous system, the brain and spinal cord. And so meninges actually means membrane. And so we're going to have what's called the dura mater, the arachnoid mater, and the pia mater. I have heard that said mater before. I'm not really sure which one's right, but I'm going to stick with mater. You can say it however you'd like. What's important is that we know what they are and what they do. And so their job is going to be to protect and support. Obviously, we have very important nervous tissue that regulates our bodies, and so we definitely need to have protection and support in addition to just our skull and our spinal cord, or our vertebra. And so also within these meninges is cerebrospinal fluid. And so we're going to start with the dura mater, which is on the outside, and this literally means hard or tough mother. Okay, this is actually a very fibrous, dense type of tissue, almost papery-like. If you've done the brain dissection, it is definitely a tougher material. And so it is the outermost layer of the brain and the spinal cord. It encloses the entire central nervous system as well as the blood vessels that enter. The second layer in the middle is going to be your arachnoid, and that may make you think of spider, and it's named because it's kind of cobweb-like. It has these little spiky structures called trabeculi, kind of like what we saw in spongy bone, and so it kind of gives it a web-like appearance. And so its main job is going to be to cushion. And then our third layer, which is directly on top of the brain and spinal cord, is the pia mater, and this one means tender mother. And it's actually a very delicate type of membrane. It adheres directly to the brain and the spinal cord, and it literally follows all of the contours and grooves and bumps of the brain. And so you can see that it's very tightly adhered. It's going to be very difficult to separate because it's so tightly adhered in contouring the brain. It's going to help in the secretion of the cerebrospinal fluid. And then together, the pia and the arachnoid mater are kind of continuous, like they're literally attached to one another, and so sometimes these are called the leptomeninges. Now the meninges and spaces, so between these layers there are some spaces or potential spaces that you can find, and so we're going to take a look at the epidural space, the subdural space, and the subarachnoid space, which their names kind of tell you where they are. And so first we're going to start with the epidural space, which means kind of upon the dura. So it's going to be outside of the dura mater. And so it's going to be a little bit different in the cranial region around the brain versus the spinal cord. So we have 2 different types of epidural space. Now in the cranial area, it's what's called a potential space. So if you look in the picture up here, here we have the dura mater, okay, and then the arachnoid mater. And so this dura mater here is directly below the skull. And there really isn't a cavity or a space in between the two. So here we have the bone, here we have the dura mater. So the reason we call it a potential space is because normally there's not a gap or an open area there. But in the case of bleeding, because as you can see it contains arteries, in the case of bleeding, you could have a space fill up with blood, and therefore it would be kind of like an open area. But unless you have some bleeding that's occurring, there's really not a space between the dura mater and the bone. Now in the spinal area, around the spinal cord, there is an actual space between the bones of the vertebra and the dura mater. Okay, so you can see that this epidural space is this purple line here. And if you've ever had an epidural, okay, these are common when a woman is going into labor. They give her an epidural to kind of numb the pain, and hopefully she only feels pressure rather than pain. And so that epidural is actually going to go into that space around the spinal cord. And so in addition to getting an epidural there, it also contains fat, veins, arteries, lymphatic vessels, some nerve roots. And so it's definitely going to be an actual space, unlike the cranial epidural. Now subdural, like the name implies, sub means below, so the subdural space is going to be below the dura mater. Once again, it's kind of a potential space. There's not a lot of area between the dura mater and the arachnoid mater. once again, unless there's bleeding, and then you could see some spaces created there. And then below the arachnoid space, you have the subarachnoid space. So this is going to be between the arachnoid and the pia mater. This is where you have a lot of CSF circulating. There's going to be arteries there. And then this continues all the way down into the spinal cord. So there's actually going to be a space here in the subarachnoid space all the way around. And we're also going to take a couple look at some diseases and disorders. So one that's fairly common, most people have probably heard of this one, is meningitis. And this is essentially inflammation or swelling. It can be caused by a variety of factors. The most common are viral meningitis, but you could also get it from bacteria, parasites, or fungi. Essentially what happens is we have inflammation and swelling, and then that swelling can cause things like headaches and a stiff neck. Now, many are treatable. In fact, there's vaccinations for certain types of meningitis, but without treatment it could be life-threatening because you could build up pressure on the brain there. We also have hematomas. Now, hematomas are not isolated to the brain area. A hematoma is just a collection of blood in an area, in an organ, in a space. Now, the reason we're talking about hematomas here is because those spaces that we talked about, you could have blood collection. So if you had an injury or some kind of surgical procedure done, it could lead to bleeding in the brain. You could have a hematoma within the brain tissue, like you see here, called the intracerebral hemorrhage, but you could also have bleeding in these spaces that we mentioned. So here you have an epidural hematoma. So remember, there's not always a space there, but in the event that you had bleeding, it could lead to that little blood pocket cavity area there. A subdural hematoma would be below the dura mater, the dural area. And then you have a subarachnoid as well. So in the brain, they can occur in the spaces between the meninges, or they could actually occur in the brain tissue themselves. Then we could also have shaken baby syndrome, which this one's pretty sad because it involves a young infant, but when they're shaken too hard, what can happen is it can cause the brain to move around within the skull, causing bleeding, bruising, swelling. It could lead to lifelong brain damage, or it could also lead to death, depending on the severity. And that's going to finish video 1 over Objective 6. We're going to cover Objective 7 through 9 in the next video.